Hi, I'm Abigail Winowich, Jessica Kirk, and we're here to report on high-quality references, resources, and apps. So the objectives for this presentation are to be able to identify 3 high-quality pharmacology references, resources, or mobile applications, and to be able to use one of those efficiently, and then also to be able to pull out some patient-focused education materials from within one of these resources. So we'll begin. The first resources we want to talk about are UpToDate and Lexicomp. When we began preparing for this presentation, I told Jessica that I use UpToDate, and she told me that she uses Lexicomp. So we looked into it further and found out that both are fully integrated and they share resources. UpToDate is a peer-reviewed source, so they provide a lot of information on drugs, but also a lot of information about anything you could think of. Diabetes care, treatment options, guidelines for any disease process, and it's constantly being updated. It also has a compatible mobile app. It also has 2 types of patient education materials. So there's a back to basics version, which is simple and easy to use for your average patient. And then there's a beyond the basics patient education resource, so that your patients with a little higher education will have better access to more comprehensive information. So one of the ways that you can access UpToDate is if you go to the UNM Health Sciences Library webpage, and right here it just has UpToDate. So to show you a little bit about the website, we'll go ahead and access it. And what should we search? We're in the endocrinology block, so let's search metformin. Well, look, see, there we go, right there, metformin. Do you want to talk a little bit about what this shows? So at the beginning is the drug information section, and that shows basically anything and everything you want to know about this medication. And you can search by category of what you want to use. So geriatric dosing to uses off-label, including off-label, all the way down to the pharmacokinetics and references about this drug in particular. But you can also go back to your search and find the patient drug information, which provides you with handouts. Occasionally there's some photos involved depending on the topic. And just, this is a good resource for, this is a good resource for patients. Another way to get to patient information is to click anything and just press right here at the top right, patient info. One other great thing about UpToDate is that if you choose, you can go to graphics and say you wanted to look for ringworm or any other thing. We'll see what it has to show on metformin. And here's some graphics related to metformin. That's great. So one of the things too, if you see right here, when we go back a little bit, is it's linked with Lexicomp right here. And you can get to Lexicomp from within UpToDate. Another way to get to Lexicomp is by going to the homepage of our library, going to the databases. I just look for the L's, and Lexicomp is right there. And so with UNM, we have full access to UpToDate and Lexicomp both, and whichever ones you want to use, it's up to you. They offer kind of different perks or whatnot. Lexicomp has large sections on labs and diagnostic tests. It also has a differential diagnosis tool. So we can just look in here under metformin. Again, it's going to be pretty similar. We'll go ahead and pick right here. And so we have the same information that we had on Lexicomp, and we also have patient education materials here and here. One of the things
that it has. Okay, so this is all the patient information. Images. And then you can also get to UpToDate from up here. Anything else? Oh, I think, yeah, look right down here. We have more education. Oh, look, here's Lexi Talk. So this talks about different issues. We have allergies, goes more into lactation, the same types of off-label uses that Abby was talking about that shows up in UpToDate and those types of things. The visual diagnosis up here is just a cool thing that this source has, where you would talk kind of trying to figure out a differential diagnosis. So we'll just say that we have, okay, I guess we're going to do dermopathy. And it gives you more information in there.
It goes more into the pathophysiology of each.
Exactly. You can look also.
If you look up a symptom, you can do a differential diagnosis workup.
Okay. Yeah. Great. So that's UpToDate and Lexicomp. And again, they require a prescription or a subscription. They're for professional use, but we have access to both of them as much as we want through the UNM system.
Great. So we'll move on to Davis's Drug Guide.
This is the one that I have used since I started nursing school. It was on my required list for my very first pharmacology class in my undergrad. And when I bought the book, it came with a free mobile download. And so this right here is just a screenshot from my phone in particular. You can see that it says 2013 here. But the nice thing about this mobile app is that it updates with new information regularly. So even though I purchased this in actually 2011 and this says 2013, it still gives me new up-to-date information. You can see right here, it says new FDA approvals and those types of things. And so those are always new and on the app as well. And so one of the things that I really like about Davis is that it's focused specifically for nurses. So when you go in and you look up a medication, it shows nursing diagnosis, it shows assessment, it shows patient education and information and those types of things that we should be talking to our patients about. It also shows, you know, all of the pharmacokinetics and the pharmacodynamics and the adverse reactions and half-life and all of those other things that we really need to know. And then we'll have things like the expected outcomes and evaluations and those things. And so it's nice. It's one of my favorite apps. I don't know if you guys can see it. But it's just been really great. It's a good one for, like, as educators. I think this is a really good app for us to recommend to our students, because this app is not for prescribers per se. I mean, I think a prescriber could use it, but it doesn't have as much detailed information as UpToDate or Lexicomp or some of these other apps that we see pharmacists and physicians and you know, APRNs using. But it's really good to use as nurse educators, I think, with our students.
What's kind of nice about Davis's Drug Guide is that it caters to both folks who want to read the book and to the mobile app, in which you can use any place and even at clinicals without lugging around your book.
Yeah, definitely. It's still the one that I use more. A lot of times for this course, I look things up on Davis and I'll find, you know, something general, and then I have to go, I'll look into UpToDate or Lexicomp to find a little bit more updated information, or more in-depth information, I should say. But this one still really gives me like a really good view of like side effects and which ones are more common and which ones aren't, and just those types of things. And it talks about metabolism and other stuff like that too. So it's a really good, like, quick reference guide. And I use it a lot in practice.
The next resource is Dynamed Plus, which was recommended to us by Ingrid Hendricks, the Health Science Center librarian. And so Jessica and I looked into it just to see how it worked, because neither of us were familiar with it.
I guess this is a new one that the university has just gotten access to, and they've added in. So we would access it the same way that we would go with UpToDate or Lexicomp, and Dynamed Plus has its own little tab here. So you can click on that, and then it provides us with peer-reviewed evidence-based information that's very similar to UpToDate, I believe. But one of the things that Abby and I noticed right away that we really liked was this spotlight section right here. And so it just had like updated health-related news stories and those kinds of things. And then we thought this over here on recent updates was really interesting too, because you can see it's talking about new things that are coming out of Cochrane reviews that were just published this year and having to do with different, high-dose ibuprofen may slow worsening of PFTs in CF patients, that type of thing.
So what's nice about the recent updates is that it shows readers updated research for evidence-based care.
Sure. And so we can show a little bit. We'll just go ahead and search our same example that we've been using to kind of go over a little bit of what it is. And so again, very similar type of information that we have like in the other ones that we've looked at. So we have our common, adverse effects, serious effects, generic names, those types of things.
What we also found with Dynamed Plus was that you could search by specialty.
Mm-hmm.
And so when you go to the homepage, you're able to just click search by specialty, and you're able to see any specialty. So we'll show you that now. And it's pretty comprehensive. So there's topics on each of those.
Mm-hmm. Yeah, so if you were just trying to figure out, what medications would this condition even use, and you could just go in and, look up nephrology and then find out like what, are some common medications used in certain things there. There's one other thing on here. It's gone. I had a thought in my head and now it's gone. Oh, it was the mobile app. That's what it was. Is that this one also does have a mobile app, and there are directions on the Dynamed Plus page on how to get set up with it on your phone, specifically using through the access that we have through the university.
As we continued through our presentation and worked out which resources we wanted to evaluate, Jessica shared with me the MMIT Network. And she described this app, and we thought it was really relevant, especially for the prescriber, in being able to provide finance-related prescribing decisions. Mm-hmm. So I'll let Jessica describe how the app works.
So this one is really good because you can look up any insurance plan anywhere in the country. You can look up state Medicaids, you can look up health exchange plans, you can look up Medicare plans, you can look up commercial plans, and you can look up their formularies. And so this one is a really good one for prescribers to be able to make these decisions quickly, like, which of these new expensive medications in this class am I gonna prescribe for my patient? One that I know that I use a lot in my practice is GLP-1 agonists, again, which we're learning about right now. But, we have Victoza or we have Byetta, and they essentially do similar things, and different insurance companies prefer different ones. And so if we write a prescription for the one that is not covered, then it creates this huge hassle for the patient. They're being told they have to pay like $300 or $400 out of pocket for this prescription. They don't know what's going on. They get upset. All of a sudden people are trying to file prior authorizations to get it approved, and it's just not the medication that's on the formulary for this insurance. And so being able to know that up front and being able to prescribe the class of medication and the specific medication within the class that is on the formulary for the patient is just going to save large, huge hassles all around. And so this is one that I use pretty often as well in practice regularly to see, so it just prevents a lot of confusion and upset and anger from patients, pharmacists, and prescribers in general, because navigating insurance companies can be very frustrating.
And it can end up saving the patient a lot of money.
Mm-hmm. Yeah, definitely, because they also might not know, right? And just shell out like $300. And, you know, or they don't take their medication at all, and it's because, you know, 3 months later we find out like, oh, I can't afford it. And it's, you know, we could have written for one that they could afford it, one that was covered 100%. So it's definitely important for prescribers, and also, you know, even nurses, just to really help, even nurses that don't prescribe, to just really help provide that continuity of care for patients.
Well, we were unable to go over every great resource. We wanted to be able to provide you with a list. So here are some other great resources for pharmacology-related needs.
Yeah, the medical director, the doctor that I work with, he often uses Hippocrates. I know that at UNM, before they took on Lexicomp, Micromedics was one of them. Abby shared Medline Plus with us. That's a good one for patients. And so we often know that our patients are looking on WebMD or drugs.com or whatnot. And so being able to provide a reference that we trust in information to give to the patients also is very helpful. One that I've looked on a lot just since being in this class is the FDA website. They provide a ton of information. And Mosby's also. This is, you know, along the lines of Davis.
Right.
So in our talks, we were trying to figure out, you know, what do you use? What are we using in practice? What is the most helpful? And both of us decided, whether you're a patient, a nurse, a prescriber, it doesn't matter. The best resources are pharmacists. We have them right there. They're at the end of a phone anytime we need them, and they can answer the most specific questions. And I, you know, call pharmacists more often than I can count. We were trying to figure out, how often do you call a pharmacist on your shift? And it was just, you know, tons.
Constantly. Every time I'm in the med room.
Exactly. And there's a phone right there, right? And I'm like picking it up. Can I do this? Can I do that? Is this compatible? What kind of line do I need to put this through? Those kinds of things. And so we definitely don't want to forget, even though we have all of these great mobile apps and all of these things, that, you know, our multidisciplinary team can also be one of our best resources.
Okay, and that completes our presentation. Thank you.
Perfect.